Hello, welcome to Akulmek Live. I am Kanchan, and today in this series, we are discussing a very crucial topic about health diplomacy and Indians' role in health diplomacy. Now, there is a challenging time, there's a crisis which we are undergoing, and this discussion we are pleased to have Mr. Srivastava, who is an industry leader, and we will discuss with him about global health diplomacy and role of India in this health diplomacy. So let's welcome him. Welcome, Sitesh. How are you doing today?
Kanchan, good to talk to you. Weekend after weekend, it's very nice. Good. How are you doing?
Yeah, I'm fine. And as you know that we are discussing one of the very crucial topic today regarding uh, health diplomacy. So I would like to understand when we talk about this diplomacy, health diplomacy. So what are the key factors when we really talk about this kind of diplomacy? Though I have read that it started in 1978, the first time the health diplomacy. But still, for our viewers, I would like to know that how what are the key factors which dictate it as a term, health diplomacy.
Well, Kanchan, you rightly said the word diplomacy, the health diplomacy was coined sometime in the mid or the late 70s. But the more in the industrial world, we are seeing the different kinds of pandemics coming. COVID-19 is just one of the latest one, probably one of the most misunderstood or deadliest, you can say. But we have had SARS before, MERS, we have Ebola, and then in the olden times we used to have those, chicken pox, and now we hear monkey pox. So the world has been dealing with these kind of epidemics, and therefore there has been a need to create a policy, the health policy. And every government has to decide it. But again, every government will tend to decide it for themselves, for their people. But then this is a intellectual property based industry, the pharmaceutical. So there is need to be less secretive, more open about the formulations for the infrastructure, for the contractors to build it, and some of the waivers. And I think in India, this is not a first thing that in the COVID-19 we have asked in the World Trade Organization to do it for raise it. But in Indian policy makers had actually started planning it in some 90s about making India self-sustainable in this. So it's a very interesting discussion, Kanchan.
Well, while talking to you or listening to you, I have come across three words which are major when we talk about health diplomacy. So that is security, which we all looking forward due to all these pandemic which are prevalent at the moment, and things are not as good because you can see there's a rise of COVID few days back, especially in India when we see the news. Then again, the economic and social justice, and most of the company, even the elite company countries, they are working towards this health diplomacy, and India is not. I think India is on the top of the list when we talk about this because they have circulated vaccine and all that. But I would also want to ask you that uh, many companies and many countries, they are focusing on micro level, not only on the top of it, because they really feel and they have understood that going into micro level are is the way to go and provide social justice and upliftment of people if they are suffering from any diseases. So what are those, especially in context of India? It how you really see, how you really deal with that?
Well, Kanchan, today in the world, you know, in the world of pharmaceutical monopolies and how it impacts the availability of the drugs, of the medicines, India cannot be bypassed because of our, we are part of the supply chain, whether it is a generic medicines or whether it is the intellectual capital that we have. And in the recent times, what our pharmaceutical companies have shown to the world. So India cannot be bypassed. And this is what was realized during the beginning of pandemic, when the whole world was grappling with how to deal with it. And that time, India and South Africa, my other favorite country, both, they put up a joint proposal in the World Trade Organization for something called a waiver. And the waiver was basically asking for lowering down the secrecy, the monopolies of the pharmaceutical companies, especially in this situation of COVID-19. And they wanted a public interest standard. Uh, and interestingly, Kanchan, this crucial World Trade Organization meeting is happening from 12th of June to 15th of June, that is tomorrow, till Tuesday, Wednesday. And India and South Africa are not any small players in the world today. And therefore, I think it will be taken forward. But what I understand now, that there are some compromises, and European Union has put up its own proposal, and therefore some compromises are there to be seen. But I think it is something is better than nothing in our hand. And let us not forget that while India and countries like India have given almost free vaccines to their people, we must not forget that Pfizer, the US pharma giant, touched $100 billion in revenue because it had profited from the sale of the COVID-19 vaccines. So there is an imbalance, and India has proposed to reduce this imbalance for the developing nations. And to tell our listeners, right now the proposal in the World Trade Organization, which has been proposed by India and South Africa, has got a backing of 65 countries.
Well, this is a good news, and we look forward that they should come to a very win-win kind of decision, so that not only the elite countries, but also the developing or poor country also get benefit of it. But at the same time, because we are discussing about the diplomacy, which is a vital role when in a foreign policy, which is a vital role in any country's development. There are also a streak of social justice we really talk about. On and on, we are always talking about social justice in any way which is being presented in news, in communities discussion, everywhere. But when there is a war, the social justice is being neglected, and same as the medical facilities are also neglected. Now, when we are talking about diplomacy, so what are the impact of social health diplomacy when we talk about challenges which is faced by world at the moment in terms of war, in terms of people, ethnic clashes, in terms of minority development. So all this, how you will suggest or how you look at it in a wholesome.
So, Kanchan, we are living at a very interesting crossroads where lots of Indians who are residing out of India have done very, very well in the medical field, either in the research or as a practitioner or as, drug creators, molecule creators. They can influence the decision making, they can influence the discussion in their respective countries. And one thing is for sure, if India's diplomacy is something like Vasudhaiv Kutumbakam, if it benefits India, it definitely benefits the developing world. And overseas Indians have a great, strength to play in that. In fact, most of our top, intellectual people in this field, I would rather call them policy entrepreneurs. These people are trying to influence the decisions towards this waiver program, this waiver proposal. And, you know, if we win this game, the exclusivity dogma that has been there with the international pharmaceutical companies, that can be lowered. And but what is happening is that the compromise formula, it is kind of being said that it will be for only COVID-19 vaccines and not for others. Therapeutics will not be part of it, and therefore the impact of it will be lower. But very few people understand that we are masters of getting our thinking progressed or proposal progressed in steps, and we have a lot of patience to get the things, even if it is one step at a time. So I'm really hopeful that this WTO meeting, which starts tomorrow and goes for next 3 days, we will see that we will do little bit go ahead of the from what we inherited in our colonial past.
Yes, I must say that now is a very exciting time when we talk about these kind of parameters, these kind of discussion we indulge in. The thing is that earlier also we were talking about social justice, but now the economic and security and the health are intermingled, and they are playing a vital role in talking to other nations, and we are establishing a guidelines what to do, not only for human life but for Earth itself. We are concerned about that, and this is quite because is an issue because India is also discussing the health in a major way. I would like to ask you, what is the future? How long we really go into this health diplomacy, and what you really foresee outcome? Though you have already mentioned that there's cutoff, we are providing free vaccine to people to countries who are, and we have done it in past also. You can see India has already given bulk supply of vaccine to our neighboring countries. But how you really focus, what is, maybe if we go for a 10-year, how this will evolve into?
Kanchan, maybe COVID-19 has lowered its intentions or negative evil eye, but I must say there are more variants that might be coming, and we must be alert, as we are seeing from some parts of the world, including India. And therefore, these discussions or negotiations must keep on happening, not just at WTO, but at other levels of cooperation. And as you mentioned in the beginning, it has a big role of a diplomacy to be played by our people who are the policy entrepreneurs, who are diplomats, who are talking about it at various forums. And of course, world has seen what India did for its neighbors and its friendly nations and countries, including in Africa. And this is what I feel is that this compromise that we are discussing today, that compromise is something that is going to happen in a very, very secretive or intellectual property or monopoly kind of a world. the companies would try to do this all the time. And today it is medicine, but we have already seen in the other aspects as well. So these compromises, you see, a little bit by bit, we are moving ahead. Okay. So, US has also agreed for this. It is actually saying that it believes in the intellectual property protection, but it also says that this is unprecedented times. So, US has joined this proposal. EU, the European Union, has also joined this proposal in a little bit of different flavor. So that compromise is also there. At the same time, 65 countries have backed this, as I informed. But US is saying that it is okay for them to support the vaccine waiver. The European Union is proposing a compulsory licensing, and there are many other details that are yet to be ironed out. And internal discussions are happening with the four members. And the compromise text that will be on the table between tomorrow and next 3 days in WTO, Kanchan, it will need an agreement between 164 WTO members. But I believe that our argument is for the humanity, for this planet. And therefore, this universal brotherhood that we propose, it takes time, but we will march ahead. We know patience comes in sweet slices, and we are waiting for those.
Yeah, it's a good beginning for a better future, I guess. And as far as I know, that India and the policymakers, especially in health sector, they are ready to share the information. They are ready to strengthen their ties with the people and the researchers and elite countries also. So we look forward for these kind of commitment. And one thing which has to be put on the table is that you have to be genuine, and you should always have mankind, welfare of mankind in your mind. That comes first, and welfare of life on earth. So that is what I think it's heading to. What you really think about it?
Yes, there's undoubtedly this is what needs to happen today. And as we know that there could be many variants coming in. Monkeypox we are hearing just probably as a precursor. There could be another ones lurking, and we have seen these pandemics in last 100 years couple of times. And when the Ebola was there, many African people, they didn't have access to medicines because the vaccines were not reaching them, not a single dose. It was taking a lot of time, and it became a humanitarian crisis. So at the same time, I appreciate the intellectual property rights where they are developed, the researchers. There is absolute respect for them. But we must understand the science is for overall good, and science cannot be exclusive. Yes, productization has to happen. Infringement rights, intellectual property rights have to be protected. But let us keep them for good times. We are not living in good times, Kanchan. It's a very, very tough time for all of us. And we should not forget what happened in wave 1, wave 2, wave 3, wave 4. And again, the interesting part is that while India, South Africa, and 65 countries are basically asking for these waivers, the big countries, the wealthier countries, must not forget the scenes from when the pandemic had hit them really hard. And we had seen those things on television all across the world. So they were equally hit. So we then realized that we are part of the same world, despite the walls that we have built ourselves. So I wish this WTO meeting to be very, very fruitful. In Sanskrit, they say Chairevati, Chairevati. Slowly, the elephant moves, and it will move.
Well, it was quite a profound discussion, Sitesh, and we just end this discussion with a positive note and with the hope that things will work out fine and they will be beneficial for all of us, you and me and everybody. So we'll be meeting again with some other wonderful discussion next week. Till then, you take care and bye bye.
Thank you, Kanchan. Keep well.
We had a wonderful discussion with Mr. Srivastava, and as you know, the security, economic, and social justice goes hand in hand, especially in this new era. And we have discussed this. I hope you liked this discussion. And if you have any comments, please, we are eager to know your views. So write to us and subscribe our channel to be informed what we are presenting in our next show. So we'll be meeting again Saturday. Till then, you take care and bye bye.